Hi, my name is Hannah, and today I'm going to be sharing some information with you from my best practice recommendation for osteogenesis imperfecta. Osteogenesis imperfecta is a genetic disorder affecting the body's ability to properly create type 1 collagen. Normally, this mutation in the genes is found in the COL1A1 or the COL1A2 genes, which will affect the creation of collagen. However, there are a couple different genetic variations that are much less common that can also cause the disease. Osteogenesis imperfecta, or OI, is commonly known as brittle bone disease and is diagnosed in 6 to 7 of every 100,000 births. It is currently believed that there are about 18 different types of OI. However, that number has grown exponentially over the years. Um, the most common types are types 1 through 5, and they are going to be the types that will be discussed throughout this paper. So for this entire paper, I listed all of my diagnosis recommendations throughout my PowerPoint. However, due to time, I'm only going to discuss one from each section. The one I decided to discuss from diagnosis recommendations is number one, patients diagnosed with OI are normally diagnosed with a specific set of symptoms to help characterize their disorder. 93.4% of all patients diagnosed with OI have blue sclera, which is seen in the picture of the eyes. What normally is the white of the eyes is a bluish gray color. 27.6% have dentinogenesis imperfecta, which affects the teeth and gums. 29.4% have wormian bones, and the number of fractures is also a common characteristic. Very few individuals diagnosed with OI will go their entire childhood without suffering from a fracture. So I only have one treatment recommendation because there is really only one treatment that seems to be working very well for patients with OI. The gold standard treatment for osteogenesis imperfecta pain involves a nitrogen-containing bisphosphonate therapy through injection. There's still not a lot of information known about the dosage and the dose interval. However, several studies conclude that this type of therapy decreases fracture rates due to a decrease in osteoclast function. It increases the bone mass density and decreases the patient's chronic pain level. The treatment does have some side effects like nausea and vomiting, like most medications, but they are short term and they do not outweigh the positive benefits of the bisphosphonate therapy. So for my management section, I decided to discuss number two, the level of activity and participation in sports and daily living should only be limited by the individual's abilities. Like I said before, there are a lot of different types of osteogenesis imperfecta, and they're varying in severeness, and individuals should not be disqualified from activities because of this. Um, with more mild types of OI, the goals of the patient's management and therapy is to be able to live a normal life. They can play sports, they can participate outside of the home. They just have to be a little bit more cautious with what they do than normal children. Where more moderate to severe types of OI, they can still maintain daily function and regular recreational activities, but the goal is to live autonomously and they can achieve that without having certain restrictions in their life. So, in conclusion, osteogenesis imperfecta can have a varying effect on the individual with the disorder. It is important to treat each case you may come across as an athletic trainer or a healthcare professional individually and with the patient's best interests in mind. Here are my citations for my text as well as some of the photos that I used, and thank you very much for listening.